Hello, Dr. Boylan here from Noretta Family Medicine. In case you haven't heard, the COVID vaccine has been approved for children ages 5 to 11. So I wanted to talk about that today, talk about some of the questions that I've been getting and hearing so far, and then also maybe talk about my recommendation about whether I think that kids should get the vaccine. So we'll start with the first question that I've gotten. Is this vaccine the same as the one that's given to adults? And the answer is yes and no. So yes, it is the same in that it is the same active ingredient as the one for adults. It is an mRNA vaccine, works in the body the same way. There's nothing different there. Also, it's similar in that it has been found to be greater than 90% effective, which is not a big surprise, given that the adult version of the vaccine is greater than 90% effective. But it is different in that the child dose of the COVID vaccine is 1/3 the dose of the adult vaccine. All right, so the second question that I've gotten is what happens if my child gets their first vaccine when they're 11 and then they have their birthday and go back for their second dose once they're 12? Well, the official recommendation is if they are 11 on the day of the vaccine, then they would receive the child dose. If they turn 12, then they're eligible to receive the adult Pfizer vaccine for their second dose. However, I think there's going to be a lot of wiggle room here. I don't know that, magically somebody needs to get the adult dose as soon as they turn 12. So I think there's going to be some wiggle room if you prefer that your child receive both doses being the child vaccine dose. All right, so the next question that I've heard, and probably this is the biggest concern, is what are the side effects? Is this vaccine safe? Well, so I just wanted to talk about the clinical trial process. It enrolled about 3,000 to 4,000 kids, which is a lower amount than the numbers that were enrolled in the adult trials. But there's a reason for that, and that's because there are far fewer kids ages 5 to 11 than there are adolescents, 12 to 18, and adults. So I just wanted to review again the process of the clinical trials and emergency use authorization and that kind of thing. So after the clinical trials are over, a company has to wait 2 months at least to apply for emergency use authorization. And those 2 months are the most common months in which people will then develop side effects from a certain treatment. And so the FDA looked at that data through the trials process and 2 months afterwards, and they found that there were very low rates of serious life-threatening side effects overall. And so they gave this vaccine the green light. What are some of the more common side effects? Well, it's going to be sore arm, fatigue, maybe a little low-grade fever, that type of thing. But are there more serious side effects? Well, we have seen that perhaps something called myocarditis and pericarditis, which are inflammation around the heart or within the heart itself, can be a side effect with young adolescents specifically. Specifically more males have developed this. But thankfully, vaccine-related infections or inflammation, I guess is maybe a better term for this, they overall have been mild. And so that's also reassuring. So just remember that also getting infected with COVID can cause this same heart inflammation as well. The fact that the dose is 1/3 that of for adults may mean that the rates of side effects are lower, but that remains to be seen. So, finally, let's talk about what my recommendation is, because I know everybody's wanting to know that. And the first thing I would say is that as different variants have come out with COVID, kids have been becoming infected to a greater degree with the coronavirus. And with that, we also think that they are spreading the virus more than they used to with the original strain of coronavirus. So since kids are being infected at a greater rate and spreading it, I do think that there is value in vaccinating children. The chances of them getting severely sick from the COVID has been shown to be pretty low, except if they have other health issues. However, if they are vectors and spread it to other people, then I do think that it is a reasonable thing to consider vaccination for them. So if you are a parent who is gung-ho and yes, let's get vaccinated, then I think it's fine. Go for it. Vaccinate your child. I think having some protection before the holidays is going to be great. And overall, so far in the population that's 12 and older, we've seen very low rates of serious side effects. So I I would think that it's okay to go for it. However, if you're a parent that is a little bit more hesitant and you're like, I'm not sure about this yet, I think that it is okay to wait for now. And the reason is because in South Carolina right now, our numbers are lower than they were certainly than, from a month or two ago. And so I think it's okay to wait for now. If as time goes on and more kids are vaccinated, they will hopefully enroll in the VAERS system, which is the side effect database. It's very easy to do that. I would encourage everybody to do that, regardless of whether you're a child or an adult. And that way we can have more data to see what are the side effects that children 5 to 11 are experiencing after the vaccine. And then we'll have a little bit more data. However, if the COVID numbers start to go back up, as we are starting to see, unfortunately, in Europe again, then you'll see me back here on YouTube probably strongly encouraging you to consider getting your children vaccinated. And hopefully by then we will have more data again. So I will be even more confident in recommending that. So. All right, well, take care. Send me your questions if you have any additional questions, and I'll be back with another video whenever I feel like it. All right, take care. Bye-bye.